James is 8 years old. He likes to be out on the farm and see the cows. He doesn't run and jump and play and act silly like other kids do. He's kind of an old soul. One doctor after another said, oh, he's just a slow grower. But, you know, as parents, we knew something was definitely wrong, something was different. Well, it was just frustrating because we could not find any answers. So I just spent a lot of nights Googling and searching for things, and somehow I stumbled upon the Undiagnosed Diseases Network.
The Undiagnosed Diseases Network provides a number of things that really are difficult to come by in standard clinical care. And I know it sounds really simple, it's doctors talking to each other.
When we first saw James, we noticed that he has very slow growth. He does, however, do very well in school. He's very engaging and bright. He had had a prior genetic sequencing study done, which was reported as normal. Part of our process is to have our research team reanalyze that data to see if they find any differences in any of the genes.
In James's case, we obtained the genetic data from a clinical lab and looked at all of the variants again. The MAP2K1 variant stood out right away to us. When we looked at this individual variant and found other cases with the exact same variant and the same disease, that's when we knew we had the answer.
It was so hard to not get too excited because I really was hopeful that we had found the answer for them. We still had a lot of testing to do, but we were really excited.
We were outside just getting equipment ready for the spring. My phone rang and it was Kathy Cisco from WashU telling me that they thought they'd found what was going on with James. I think I did tell her, I said, I think I love you already. I said, you're just a wonderful lady. And to get that news that you've been waiting 7 years to hear that someone has actually found something that they think is wrong with your child, that you've been waiting to hear answers from, it was an amazing phone call.
So one of the big benefits of the Undiagnosed Diseases Network is that we have a multidisciplinary meeting where we go over all their clinical information as well as the genetic information. And so during that meeting, I was able to talk with Dr. Grange, his clinical geneticist, and we decided together that we thought he would benefit from being on growth hormone. Over the past few months since getting on growth hormone, James's growth rate has really been increasing, and so you can see him starting to get closer to the normal growth curve.
When we finally got a diagnosis, it was a relief. As parents, we knew he was going to be okay. It was just a genetic mutation in his MAP2K1 gene. We knew he's just going to be little. We can deal with that, but at least we know he's okay. It was just a great sense of relief.